Hi guys, I'm Coach Beck and I'm here with Dr. Kurt.
What's up?
We're back talking about preventing common running injuries. Today we have a band and a Hypervolt. If you have those, go grab them. If not, no worries. You can do these exercises without it, except for obviously the one with the Hypervolt. Today we're going to talk about Patellofemoral syndrome, and we're going to just run through a strength exercise and two exercises here with Mr. Dr. Kurt. And yeah, let's go.
Cool. So like Beck said, we're going to be focusing on the knee with this, primarily Patellofemoral Pain Syndrome. Basically just a fancy way of saying knee pain. But some of the key things here and signs and symptoms of this condition is some clicking, some grinding that feels right underneath that kneecap, especially every time you strike the ground or walk upstairs. So primarily this tends to be caused by some weakness in the hips, some mechanical things off at the hip and the knee. So with these drills that we're gonna look at today is trying to open up and decrease some of the tension on the quad and then focus on getting those glutes engaged. So what Beck's gonna do first is we're going to loosen up this quad here. So she's gonna take her Hypervolt.
Turn that bad boy on.
Level 2 primarily is what we're gonna wanna use to tackle some of the bigger, these tiny quads that Beck has. We wanna use a little bit of a heavier setting here. So what she's gonna do is she's gonna keep her weight loaded onto the back leg, so her front quad is relaxed. She's going to start on the inner portion of her leg, on the quad, and she's going to run the Hypervolt up and then reset, start back down again, and strip up. So ideally what we're doing here is we're trying to funnel and get some of this fascia to open up and promote it to start to come back up towards the attachment point, which will help create some space at the pelvis for her. So as she's fanning up, she's working up now the middle of the quad, and then she's just gonna slowly start to kind of get to that outer portion of the quad as well, finishing close to that IT band, but not directly on top of it.
And you want to do this for about 30 seconds to a minute?
Yeah, minute generally is where you want to stop with a lot of fascial release. 30 seconds is kind of that low end. So in between 30 to 60 seconds, and then we'll switch and she'll go to the other side as well. Cool.
Good.
From there, once your quads are nice, loose, and limber, we're now going to work on opening up her hip flexors a little bit more. Hip flexors tend to be a real big cause of putting unnecessary stress into the knee, especially if they're very tight. So what Beck's gonna do here, she's going to squeeze her glute of the leg she's working. From here, she's going to try to keep this tension here the whole time. She's gonna drive her front leg forward and swing her arms straight up overhead and allow the ribcage to tilt just a little bit, so you should feel a small stretch in the abdominals as well. She'll switch back, try to keep constant tension on those glutes, drive forward, tilt up, feel the stretch, making sure not to lose this contraction, because if you do, let go of this contraction here, Beck, dive into, you'll start to see she gets into her low back quite a bit.
Oh
and
boy.
It's not very comfortable. So she'll switch back out, keep that tension here, drive the knee forward, and you can see she stays up relatively tall, but she gets a small tilt on the rib cage, protecting the back and stretching out the hip flexor through there. So I'll run through this about 10 to 12 times, flip and go to even the side that's not bothering you, because you want to keep everything nice and mobile.
And that feels really good.
Cool.
And then, my favorite part, we're gonna go into a strength exercise, and I'm gonna make Kurt put the band on.
Yeah, cool.
This is a strong band.
For a strong man?
It's for a strong man, that's it. He's gonna go into all fours. We're gonna work on a fire hydrant, okay? So if you've worked out with me before, we have done these. So the main importance here is we're gonna strengthen that hip area. So here's in all fours. You wanna make sure that your wrists are underneath your shoulders, your knees are underneath your hips. You're in a nice neutral spine, okay? And what we're gonna do is we're gonna raise that right knee all the way up nice and slowly to hip height, really trying to switch on those glute meats. Okay, so I like to make sure that you guys are talking to your muscles as you're doing this. So he's exhaling on the way up, but he's also really trying to work that peachy butt. Okay, so what I normally do is I'll put 15 to 20 reps on either side. Okay, so go right side and then you'll go left side. And the drill number 2 today is you'll go straight into it's like a donkey kick. We're gonna straighten that leg out on that left side, nice straight leg, keeping the toes tucked under, and you're gonna drive the heel all the way up. Okay, so really get into your glute max. All right, and whilst you're doing this, you do wanna make sure that your core is switched on and we're not moving the hips. Okay, fast repetitions is not what you want here. You want it nice and slow and controlled, because we're really trying to activate those stabilizing muscles. Okay, good work, Kurt. He's a runner.
We're ready.
Look at him.
We're ready.
All right, we hope that helped you. If you are having any troubles with the runner's knee or patellofemoral syndrome, and like always, if you have any questions, hit us up. We're here for you. Have a good day.